to our meeting here today to tell us more about the staying at home program that they're running. Thanks, Dora.
Thanks, Sarah. It's lovely to be here. Yeah, I don't have any script prepared, so I'd love questions if people want to ask me whatever they would like to know. A brief overview of us is we applied for the same grant that Caledenia did for the staying at home program. So Treehouse for Two, we have 6 dyads. So the person living with dementia and their carer. We try to get 6, I should say, that's our aim for each program. We're up to program or retreat number 20. So yeah, we've met a lot of wonderful people along the way and hopefully given them some tools to keep going with the things that they're experiencing. So we have the retreats that run in, I've forgotten my words, in Lancefield. So it's in a winery in Lancefield. It's called Glen Erin. And they have really come along the journey with us. So when we first started, you know, they weren't sure what to provide for us, but they've taken our guidance. So we have more signage for where the toilets are. We've got signs on the bedroom doors so they know which room is theirs. And the staff take the time to, you know, take their coffee orders, for example. They know to ask the person living with dementia, not their carer. Everyone wears a name tag, including all their staff. They wear our name tags just so that it's more inclusive for everyone. And yeah, we've learned from them and they've learned for us. Sometimes they're an extra set of eyes. If someone goes exit seeking, they'll be like, I think Bob went that way. And so we'll, you know, head off that way. Or, you know, I'm pretty sure they're just in the toilet. And yeah, they've become part of our team, which has been fantastic. They've also taken on, so we had, it's a wedding venue. So they have their meals on beautiful black plates, but they had roast meat on black plates. So the participants, couldn't see where the food was. So I just mentioned it to them and they just quickly took the plates away, replated them on white plates and brought it out and everyone was happy. They've done things like portion managed. So sometimes the bigger plate just means that nobody's eating anything. So they brought out smaller plates and then they can have second serves. They can have as many decaf coffees as they want. They've really taken the journey with us. So that's definitely been one of our learnings. I think one of our challenges has been, as Sarah and I were discussing earlier on, the intake, or trying to work out which clients go with which clients, because it'd be great to have, you know, like for like. So if they're at this part of the journey or they have this diagnosis, if we could bring a group of them on, then that helps them to provide, you know, similar support to each other. And sometimes that's worked and sometimes it hasn't. We had a group that were 5 gentlemen and one female, and she said, I think I would have done better if there were more women. So we've tried to at least do 3 and 2 or 3 and 3, or have all of the same gender. One of the other learnings that we had were the people living with dementia noticed that the carers were all getting, you know, show bags. Like, where are our bags? So we've created some things for them, and it's included, and Paula and the team have done it. I just get to talk about it. Oh, it's doing it in Mirror, but we've created a handbook so that they can use it, and we've got this electronically if anybody wants it, but it's got some memory tips. I should turn my background off, I guess, if I can work out how to do that. Anyway, you'll see it's a booklet that just talks about things that they used to like to do and have stopped doing, things that they would like to try, you know, new things that they would like to try again, and things that they don't want to do anymore. Just because I used to like mowing the lawn doesn't mean I have to keep doing that. Gives them those options. So that's been really good learning for us. And yeah, the booklet has come from their input, the people living with dementia. We've had a few groups who have got together after the retreats. It was something that we hoped, you know, somewhere in the pie in the sky ideas that we could facilitate some reunions, but it just hasn't happened. We just don't have the time. So one of the, we call them our super group. They've been getting back together like every couple of weeks, and it's been fantastic, whether it's, you know, in person or on the phone or whatever, but they have really stayed in touch and really created a support network for each other. It's been fantastic. Yeah, they're the sort of things I can think of off the top of my head. Does anyone have any questions, or is there anything that I can give you some more information on? Yeah, Amy.
I just want to know the Treehouse program, stay at home program. So any location, you know, where is the catchment area? And also, you know, how to access this program? Is it, you know, still going through my aged care assessment?
Yeah, thanks, Amy. So it's not through My Aged Care. It's getting on our website or calling Paula's phone number. But the best way is through the website. And Sarah, I can send you that email and web address. We, unfortunately, or because of the way that the program is created, if we just took everybody off our wait list now, we'd actually be full. It's such a shame. And we know, as Sarah was saying, the preference would be to take people who are early in their diagnosis. But, sometimes they're on the wait list for so long just because of others who are ahead of them. So we still need people to be referred. We don't want the referrals to stop. We're just kind of acknowledging the fact that we're almost at capacity. We need to work out of those people who will we be able to actually bring on, who can we refer, and we have referred to Caledania, and who will still get benefit without going to the retreat. So, Amy, there's no catchment, so to speak. When we put our application in, we talked about the regions where our health service is, so Macedon Ranges and the Hepburn Shire, but we've taken people further out. So Phil, I forget his title all the time. He's the chief. What's his title? Anyway, it's really important. I'll send you his name, his title. He went and spoke to Rochester and Echuca Health Services, and we've had several people from Echuca, from Kyabram, from Yarrawonga area. We've also had people from Mornington. We've had people from Gippsland. So, especially at the start, we just wanted anyone who felt the need, and we saw that we can assess the need for them to come. They fit our criteria. They were coming. Now we have tried to bring it back to our shires, but there are still people outside of that who need it. And like Sarah said, with only 4 providers within Victoria, there's a lot of people, there's a higher need than we can meet. Yeah. Which is sad. Sad that there's such a high need, and sad that there's not the provisions. And at the moment, the funding does finish 30th of June. So, yeah, and I haven't heard any different that it's going to extend. But
no.
Yeah.
And I will say too, Dora, we are also maintaining a waiting list because, one, it does make it easier to mix and match those groups as they come up. But 2, that if there suddenly is a call for the next round of funding or evidence needed for the next round of funding, your program, my program, all have wait lists ready to go. I would hate to wind it all up, finish all the publicity, stop the website inquiries,
and then they say, hey,
and then suddenly find that they said, oh, your funding's extended, and have to start all that work all over again. So we're kind of hanging in there right till the 11th hour.
Yeah. So yeah, Paula's been really great. Paula is our retreat coordinator, and she's fantastic at keeping all of that data. She does magic with it. So at the moment, there are 51 people on our wait list. Of them, we've had some late cancellations, so they've come off, and we'll see whether we can get them back in somewhere else, or if their needs are too high. So when we've accepted them on, to do the assessments, they've got higher needs than what we can provide, because we're not in a care facility. We're literally in a winery. So if they can't get into the shower that's a little bit higher, maybe we could assist with a bag bath or something that the carer could wash them with. But if their mobility is that limited that they can't get around, there are some gravel paths and things like that. If they can get a wheelchair around that, that's okay. But it's all part of our assessment. But of our assessments, there were 6 whose needs were too high. There were 3 who, by the time we actually got to doing the assessment, they actually were not interested anymore. So other opportunities had come up, or it wasn't for them. We actually had one gentleman, sorry, I'm not sure if they're male or female now that I've said that, but someone had passed away before we could even get to bringing them onto the retreat. And we've got 4 who've gone to alternative staying at home programs. So that's just an idea of our wait list at the moment. Yeah.
And I think, Dora, you talking about how far-flung people are coming from is indicative of the programs all starting at the same time, and it was a pity there was no coordinated sort of overarching, you all live in this area, you all live in that area, because we were the same. We've still got people coming from Gippsland, from Mornington Peninsula, from Mount Martha, from way out the other side, Castlemaine, I think someone came from. So
so they're potentially crossing paths to,
That's right. And I think if it did continue, I'd be really interested in kind of setting up a central initial wait list or something that could at least be geographically divided up. And then people still have the choice to go to the one they want to if they want to. But
at the core of the program, we've all started with the same tools.
Yeah.
So, there will be differences, but there's nothing to say that yours is, we're of the same quality, really. So,
Yes.
Yeah. And it's just location. And I think also the benefit of going somewhere, if you go with people who are local to you, then you have that support when you leave as that group. But also, like, I don't know what the supports are in Mornington. I can't tell them there's a social support group who have a dementia focus, or there's
That's
this
been a huge
GP
challenge.
who's really, really good at following up on these things, So, yeah, I could see the benefit. Paula was also talking about, and who knows who could do this, but some sort of map so people can see where all the supported home programs are and, potentially what our wait lists are, or I don't know, something that would give them some information about, what to choose or where, or, it's not a destination holiday. It's providing support that could potentially happen closer to them. Yeah. So,
yeah, that's a great idea.
All Paula's ideas.
And sorry.
Can I just ask, the program that you deliver, Dora, and also the same with you, Sarah, is that pretty much based on the Hammond Care model? Is that,
yes.
But you're delivering it quite independently from Hammond Care, right?
Yes.
Okay.
Yes. Yeah. So it was, once Hammond Care had piloted it, and it was picked up by the Australian government as a response to the Aged Care Quality Commission thing. And then it was tendered out to whoever wanted to apply to run it. And you could either apply to run what they'd run or something new and innovative. And Treehouse for Two and Caledonia both went with the Hammond Care model.
Okay. Yeah, because we applied for the other stream, which is stream 2, and you're stream 1, I think. So we're kind of in the same boat, so to speak, when it comes to the funding of it. One of my questions is, because we are basically catering to the needs of the COLD community, and specifically the Greek community. And we did at some point try to work with Hammond Care in terms of getting a specific program in Greek for our clients, and it kind of wasn't going to work, knowing our clients, knowing the capacities and knowing what they needed. So it was kind of very information heavy, I suppose, because most of our carers, we're talking in that sort of 75 plus age group, which is quite challenging for them to manage a lot of the information and the resources, and especially when not a lot of it is available in Greek. So my question was going to be whether you had any clients from COLD backgrounds, and how was that managed, and what was the result from it? What was it beneficial to them? Did they get anything out of it? Those kinds of things.
So, Lucy, I can think of quite a few of our participants who were born in other countries and came here, who have a cultural and linguistically different background. But it often was either their spouse or their children. English is still strong for them. And so I think that's how we could support them in the carers group. In the participant or the engagement group, there were some challenges, but you could get around it with music and movement and, jigsaw puzzles. And those who have come, we've been able to engage them quite well. And Paula was just telling me, this last group that we've actually got people from, I think, 3 different cultural backgrounds. So it's going to be really interesting to see how that goes. But we do say for the carers, they need some sort of English background, because we don't want them just sitting in a room getting bamboozled. We don't want to waste their time. That's probably where we're at. But it's ridiculous like, we don't want to just exclude everybody who doesn't have English as a first language, but like you said, even for us who are only English speaking, to deliver anything in another language, we couldn't do it. So it's been good to have that next generation down come, for example. So it might be the mother who has dementia, and it's the father and the son who are sitting with us learning, and he can kind of break down, you know, not break, well, he can break down emotionally if he wants to, but he can break down the information, and this is what they're saying, or this is, you know, and we can go back if we didn't.
Thank you.
Really important.
And have you had, Dora, anyone who, you know, the intake all went really well, they sounded very suitable, and once you got to the venue, they were really unsuitable?
Yeah. So we had one participant, or a couple, and the husband had actually called Paula the morning of to say, we don't think this is for her. And Paula said, that's a good time to call it, then don't come. And then he thought about it. Oh, sorry, that was the night before. Then the morning of, she was fine. And so they came. But through that day, it was quite evident that she was getting agitated with, if nothing else, she wasn't in her own home. She didn't know the surroundings, all the things that affect someone who has a dementia diagnosis. And she was actually having quite an episode. So we had to keep her engaged. It was the day that we have a geriatrician who comes. And so it just happened to be that it was that day. And so she didn't want to see the geriatrician. This particular participant didn't like geriatricians, and we hear that a lot. And so we kept her engaged and, you know, just kept her moving around the space until her son came. And they had some inkling that it might happen. So they'd been talking to their GP about what they could do if she got extremely unwell or acutely unwell with her dementias. And what they did was bring her a medication, which happened to be like a not a mood stabilizer, but a bit of a sedative sort of thing. But he had said to his mum, this is for your bladder, you know, you've got problems with your bladder, and he could take her off site. But it would have been a bigger problem, you know, if they didn't already have that in place. So after that, we've just kind of thought about it more and got more things in place. I think every time we have an element of risk, we work out another way to mediate it. That's not the word. Mitigate. Yeah. But for that lovely lady, like, she was traumatized from way back, and there were things coming up for her, and she couldn't get any comfort from her husband, because sometimes it's the other person who could calm them down. He actually became, in her mind, he became the enemy. And so we were grateful for that, because we probably would have had to call the ambulance, or I'm not sure what the next steps would have been without that son coming from Melbourne to help her. And she's, you know, she's in a better place now. She's much more comfortable, and better looked after.
We had a very, very similar story where, you know, they had interviewed over the phone beautifully, and when we went through all the questions and all the assessment, she was physically, the lady was physically able to do all the things that we ask, and because this gentleman had sought no help at all so far, he was under the impression that her dementia was quite early days, and also they'd just had a diagnosis, which we found out later was probably 6 or 7 years overdue. And same sort of thing. He was the enemy. She was really anxious and upset and calling out and sort of pacing around the grounds. And we tried to give the husband as much time with the group as we could, so our staff sort of dealt with it for the day, but they were never going to stay the night. They were going to go home and come back, and they just never came back, unfortunately. And we followed up. We ended up calling DBMAS and having DSA, and, you know, just getting in as much help as we could for that that poor guy. And it ended up, poor lady got taken away in an ambulance against her will. So. But that was a real eye opener, and I'm not sure what questions you can ask that will actually weed out some of those. really inappropriate people.
And I think one of your questions, Lucy, was, like, is it like the Hammond Care setup? One thing that we've done differently is it's in the winery. So they've got their own room and they've got their own bathroom. The Hammond Care one that I went to, and Paula went to one as well, it was like an Airbnb house. So it was all really in this one space, and you're out of your door and you're in everybody else's space where they can walk the grounds of the winery. And so that gives them more. So that was a little bit different to Hammond Care. But also Paula was doing a lot of the assessments in their home at the start. So that was like, we really got to see them in their space. But then we worked out we kind of need to see them out of their space, because we need to see what will happen when they're in unfamiliar areas. So then we've, at times we've asked them to come to Kyneton Hospital. So then, they're coming to somewhere different. How does that feel? Or somewhere known if they're in the area. We've done a few assessments by video, but Hammond Care, from my understanding, did them all by phone. So
yeah, we're doing them all by phone. If I applied for the money again, there would be a lot more put towards the assessment, and I would want to at least meet them over video, if not in person. Yeah.
Sarah, when we started the meeting, I kind of came into the middle of a conversation, and you were saying that had we known what we know now, it would have been a very different sort of application process. And you were talking about reporting a deficit, and I wasn't sure what was that in relation to. Is that the staffing deficit that you were referring to, or the assessment deficit that you were referring to?
That was actually Sarah's comment, and she's frozen on my screen. I'm not sure.
Yeah, she's frozen on yours.
So we've increased our staffing immensely since we started.
Sorry.
That's okay.
Yeah.
But did you want to talk to that, Sarah? Just you had said about reporting a deficit.
Yeah. Oh, sorry, I missed the end of Lucy's question because I dropped out. And I think it was, if we'd known what we knew today, what would we do differently? And there would be a lot more time factored in for the assessments. A lot more time factored in, not just for assessments, but for, I'm going to call it the initial orientation, what's going to happen, when it's going to happen, how it's all going to work, and an awful lot more time for the follow-ups. Some people have been quite difficult to reach again afterwards. And some, you just end up playing phone tag back and forth, back and forth, back and forth. I've suggested to Leanne that she actually set up a bit of an appointment thing. I've got these 5 times next week. Can you commit to one of those, just so you're not doing that back and forth, back and forth? I think we underestimated the staff hours necessary.
Definitely.
So we do 2 activity staff and 1 carer trainer, and that's it for the 3 days, as well as an overnight person. And we really could have done with another person factored in for the retreats, like Hammond Care recommended, a kind of house mother type, someone who's just there and over the whole program. And more management hours. Yeah.
And that's, so you have how many participants at each retreat?
We have at a maximum 5 couples, where the venue we've got, we're more comfortable with 4 couples.
4.
Yeah.
And what we didn't factor in was the assessment times at the end. So we've got retreats going right up until June, and we're trying to move them forward a little bit if we can, but then we don't, we're not going to get a 6 week and a 6 month. And we'd said that to the department within our first year, once we'd worked it out, and they said, that's what you've said you're going to deliver, that's what you have to deliver. So
yeah, we had a couple of questions and we got the same answer, just you said that's what you were going to do, so do it.
So in my mind at this point in time, and we are requesting, once we've put in our next report, we got a bit of an extension because we had some sickness. We are going to ask them what any suggestions, or what do they think, because otherwise we're not going to have any data for the whole of 2026, really.
Yeah, wow. Okay.
Mm.
Maybe we'll have 6 weeks, but not 6 months. Yeah. So we're requesting another. Well, we're going to request a meeting with them. And this is all stuff that I had no clue about, but Paul is onto it, and Phil, I should have looked up his title in that time. I feel bad. I don't know his title. Oh.
Yeah.
It's been a big learning curve for me.
Mm.
All right. Phil's title is Executive Director of Community Operations and the Deputy Chief Executive Officer. So
Brilliant. Good.
Deputy CEO. Yeah. I knew it was all in there.
Yeah.
The other thing I guess that I didn't realise, and nobody would have, was how comprehensive the reporting is.
Yeah.
It's huge, that spreadsheet with all the percentages, and is a lot of work.
And thank goodness Paul is really good. Like I keep referring to, but I think she's amazing. The detail of, is it a percentage or is it a number? And then is it for the whole time of the grant, or is it this last 6 months?
Yeah.
Or is it the 6 months after? Is it I'm like, I don't know what they're even asking. So Paul is forever explaining it to me. But you need a whole person just for that.
Yeah. And it's the same for us. I mean, I imagine it will be a similar thing, but, in the same report, they were asking financials for the whole 12 months, like the whole 24, 25 period, but then everything else was
6 months.
6 months, and then it does your head in, especially with the numbers and for us, I in particular, because we have to do these surveys every 6 months, which I think you do as well.
Yes.
And it is such a laborious exercise. It takes us 2 months to complete each 6 month thing, because we actually physically need to have a staff person assist just about every person. No one can complete it on their own. And somebody said from the department that somebody was like from the family members or carers were helping them. I said, well, how can you do that when one of the questions or two of the questions are about their relationship within the marriage, if they're married, and the family? How can a carer be it just didn't make any sense. So we actually have, I've only got 2 team members in my team, but they go out to 12 day respite groups every time to interview the client or sit with them and help them do the survey. It's just an enormous exercise. And plus we've got a qualitative survey, which was what we said we would do at the beginning before they asked for the quantitative survey. So we've got a double whammy. So it's just but we're getting some amazing results, and that's really the report. It's an independent report by NARI who are preparing it. So we've got some amazing things to give them back. So
wonderful.
So it's worth it in the end.
And that's one thing I was glad that Paula pushed for was like a data collection service. So we have the input, we input all the data. That's still a person sitting typing or what have you, but then they process it and send us back reports that we couldn't have created. So that's been useful. And thankfully when the application was put out, someone thought about that and put a bit of allocated budget to that. But Paula really prioritized.
That's another thing I wish I'd done.
And lots of learnings.
Ivana, or pardon me, Amy or Deborah, any questions? No.
Not at this stage. Thank you very much, Dora. It's very, very informative.
Oh, thank you.
Yeah, I think the program was really good. I tried referring clients.
You tried?
What happened? Did we get back to you or?
Oh, no, it wasn't that, Dora. It's just my clients that I tend to see just don't engage.
Oh, okay.
But I
Oh,
did
Which is
that's a
why they're
shame.
seeing you, Deborah.
Yeah,
Yeah,
we did
that's
have
right.
some from a couple from the Welcome Cafe that went to Sarah's.
Yeah,
That was
Oh,
that
great.
first year, I think, that you started.
it
And
was. Yeah,
they came back and said it was such valuable information and support.
yeah, yeah,
Mm.
Yeah.
yeah. We should keep in touch. I think the idea of mapping some of that stuff across our programs, even if it's only basic stuff, would be really good. Like, location of referrals and just something to have at the end of it that, I mean, I know they'll do all that sort of thing, but it'd be lovely to present them just with the three of us got together and here's what happened for our 3 programs and the areas that people came from or something.
Yeah, and the lack of support that Paul has identified is crazy. Like Mildura doesn't even have a geriatrician.
Yeah.
No geriatrician. Yep. There's one gentleman who spoke about he was just going to go to the local aged care facility and just wait there till a geriatrician came. Like they just can't even get assessed. It's so sad. Yeah,
that is so sad.
Yeah, yeah, real, really eye-opening. And sometimes I think, oh, we're only providing a retreat, but they all get back to us. It's not only, it's a moment in time where we can learn, and it's about this, thing that's happening to us, not just a person living with dementia. And, it's before and after retreat. They kind of talk about it that way, but yeah.
I will say that one of the challenging groups we had, I was doing the carer session and it was for people with young onset and younger carers. The lack of information, lack of services that I could tell them about in that whole section where you talk about where to go next, who to contact for information when there's nothing, was really difficult.
Yeah.
And we ended up with some very not militant, but people who wanted to get out there and change the world. They were so frustrated that there was nothing around and it wasn't fair. So
I will say something that I quote you on a lot, Sarah, is that you can't, we need to hire people who have a passion and we can teach them the rest. I definitely got that from you at the National
absolutely
Conference. Yeah. If we hire the right people, obviously we need people who are willing to learn, but if they've got that passion, the rest can come.
That passion and that respect. Absolutely. Yeah. All right, well, thank you very much. Oh, sorry, Lucy, go on.
That's okay. I was just going to comment about the whole lack of information thing. And I find it quite interesting. And I don't know whether it's because I'm constantly looking up dementia-related stuff online. So the algorithm obviously is bringing up a lot of stuff for me to look at. But I think that there has been an increase in advertising and promotion from both Dementia Australia and Dementia Support Australia and Dementia Training Australia and all of those kinds of things, because there's quite a lot that I'm seeing. And yes, I do read a lot of stuff about dementia online, so therefore I would see more of it. But I'm just wondering whether it's getting to the right people, because we hear that all the time. People don't know where to go. They just they've probably heard of Dementia Australia, but I'm not sure that they actually fully understand what they do apart from fundraising, maybe. It's just that that kind of thing. And again, for us, one of this last 12 months especially, we've been doing a lot of information and community education programs, so and in language, like in most, and doing it with an interpreter, getting people, presenters from the various organizations, but then having an interpreter. So we're just finding that as well, people don't know, and I'm not sure why that is, when there seems to be a lot out there. But again, I don't know if it's because I'm seeing it because of what I'm looking for and it doesn't quite reach other people. Yeah, it's quite interesting.
It's that age-old question. If you're not connected, how do we find you? How do we get
Yeah.
to you to give you the information to get connected?
Yeah. 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 Interesting. Yeah. Even it seems to be, it has to go back to the basics of the doctor, the GP, or the nurses, or I don't know, just those kinds of places.
And I think, Lucy, that's why there's so much talk recently about navigators, particularly for young onset, that some central point that people can go to and who will tell them what's available and what they're entitled to and what the path looks like, because that doesn't exist.
Yeah, and even that post-diagnostic clinic that happens for people who have a cancer diagnosis, there's nothing for someone with a dementia diagnosis
No.
yet. I think that would help, because otherwise it's just CADMs and then see ya.
Yeah, and CADMs are not funded to do anything except diagnose. They can't refer out. They just don't have the funds or the funding. I'm not sure if you're aware of Lainey Bradley's spoken to one of our groups, and she and colleagues who have worked at CADMs have set up a private diagnostic clinic where they do the follow-up. They do have allied health services, and they provide services and help people navigate. They're called Specialist Memory Services. They're in Box Hill.
Okay.
But people have to pay either privately or use their private health and private funds to access them. But people are doing it. They've got a wait list. So
just on that, Sarah, Rebecca Hine.
Yeah.
So her program, and let me just find it, you can actually get it funded through the Carer Gateway.
Dementia resilience.
Yes.
Yeah.
Yes.
And she's working with Lainey's clients as well as her own clients. Yes, and I can send out that information if people want, or if you've got it there, Deb, you could put it in the chat.
It's a bit hard.
I'll send it out with the video. That's right.
No, if
you can do that, yes, because she only just emailed me yesterday to say that you can actually get it funded through the Carer Gateway, home care packages as well.
That's fantastic.
Lainey info, and My Dementia Companion can also be funded through CHSP, through a home care package, Carer Gateway, and NDIS for clients, carers. Lainey info and Rebecca Hine info.
Yeah. And can I just put a plug in for the Welcome Cafe for under 65s? So Health Ability, we have, it's called the Welcome Cafe for YODs. So it's for the client with the person with dementia and a partner, family member, friend come together. It's just a casual morning tea, but we provide support and, just a good, nice cup of tea and coffee and a chat. So
where are you located, Deborah?
So in Box Hill. So we actually use the Melbourne baseball club rooms because it's, a friendly environment with, disabled toilets, got lots of parking. But if I send Sarah I'll just send you the
I'll send it out.
The flyer. Yeah, that'd be good. So so we really struggle for referrals for odds.
Yep, will do. I'll send all of that out. Thank you very much, everybody. That's been a great discussion.
Thank you.
I'm sorry there weren't more people here, and hopefully lots of people will watch it online afterwards.
It's been great. Thank you. Thank you.
Thanks very much. See you, everybody.
Bye-bye.
Bye.
Bye.
Bye.